This is Dr. Scott McLean, and this is a YouTube video about implant dentistry. During this presentation, we'll be discussing the ASC in the premolar area. Now, ASC stands for Angulated Screw Channel. ASC abutments are made using the Nobel Premolar 2G scanner, and as you can see here, it can make a number of different other items. But once you have it into the computer, you can choose whether you're going to angulate the screw channel or to keep it straight. So looking at these two premolars, you can see one does not have to be changed at all, so it's going to be straight, where the other one is going to be angulated to improve the aesthetics and also to improve where the screw position will be. Now, whether you keep it straight or angulate the channel, you'll be using the ASC OmniGrip screwdriver technology, which is using an OmniGrip driver shown on the left, and then the screw itself, which is shown on the right. And these screws are slightly longer, so you can't interchange them with the older Unigrip screws. So you do have to have this kind of specialized screw for the system. And the reason why is because you're using a titanium adapter underneath this crown assembly, underneath the zirconia abutment. So this means that the screw has to be a little bit longer. But when these snap together, you'll see that it's an articulated system, which makes it very easy in the back of the mouth to place this screw. You will tighten this down to 35 Newton centimeters, just like the other Unigrip screws. But you see, as this turns, it doesn't have to be on the same axis as the screw, which makes it really fantastic. So here we are. We're going to take the channel and tip it slightly to make it a little bit better. We can tip this up to 25 degrees. So by taking it more towards the occlusal aspect, means that the zirconia, which is shown in kind of a beige color underneath, is going to be uniform, where the more brownish color is going to be the porcelain addition. So the technician's taking this and idealizing where they want the occlusion to be. There's the titanium adapter we spoke about underneath the crown assembly. It's important to note that you can also have these made in full contour zirconia as well. So you may ask why I use this. Number one is that you can avoid cement. You can actually do screw retained crowns in the posterior 100% of the time, or nearly so anyway. And number two is that you're avoiding gold, which is a very expensive material to be using in the posterior, especially because you're having to place gold in an implant crown. It replaces the whole tooth itself, so not just a shell over top of the tooth, it's the whole tooth. To be able to use this technology, a number of things have to occur. You have to ask your surgeon to place a conical connection implant. So this is from Nobel Biocare, so either the Nobel Active CC, the Nobel Replace CC, or the Nobel Parallel CC. Second, you need to buy an OmniGrip driver from your Nobel Biocare rep. And these are not a very expensive item, and they'll fit into your prosthetic kit. And last, ask your dental lab if they have the Nobel Premolar technology, because they're going to need this to make the ASC crown, so you should ensure that they do have it so that they can manufacture components that are going to fit in the implant as optimally as possible. And this is critical, in my opinion, to long-term success with dental implants. This is Dr. Scott McLean, and this has been a YouTube presentation about implant dentistry.